Welcome to Using Lay Language in Health Communication series. This is Module 1. Why should you use plain language to communicate with patients and the public? My name is Terry Otteson, and I am the Community Engagement and Health Literacy Librarian at the Health Sciences Library, University of North Carolina at Chapel Hill. In the first module, we will discuss why you should use plain language, also known as lay language, to communicate with your patients or the general public. Specifically, we will define health literacy in plain language, look at health literacy levels in the United States, examine the relationship between health literacy and patient outcomes, and learn to recognize and meet the needs of patients with low health literacy skills using either validated tools or adopting the universal precautions approach. What is health literacy? According to Healthy People 2030, which is a set of 10-year national objectives with the goal of improving the health of all Americans, personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Organizational health literacy is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Health literacy isn't just the ability to read, it includes a broad set of skills including reading, writing, listening, speaking, numeracy, and critical analysis, as well as communication and interaction skills. Health literacy is really about the interaction between individuals and the healthcare system. Doctors and other healthcare providers need to communicate in a way that is easy for the average person to understand, and this can be called clear health communication. What is plain language? According to plainlanguage.gov, plain language makes it easier for the public to read, understand, and use communications. It's communication that your audience can understand the first time they read it or hear it. Why should we use plain language in our communications? We're all busy people. We don't want to have to translate difficult, wordy documents or communication we receive verbally. It can help prevent misunderstanding, which is particularly important when it comes to health information. In the United States, a landmark study called the National Assessment of Adult Literacy, which was conducted in 2003, included a health literacy component. It is still the most widely cited study and estimate of adult health literacy rates. Almost 9 out of 10 adults may lack the skills needed to manage their health and prevent disease. Only 12% of adults have the proficient skills needed to effectively manage their health care, according to an evidence-based review of health literacy interventions from the Agency for Healthcare Research and Quality, or the AHRQ. 50% of the U.S. adult population, or approximately 90 million people, may have trouble navigating the healthcare system. These individuals are at greater risk for poor health outcomes and at higher costs. According to the report Low Health Literacy: Implications for National Health Policy, low health literacy is a major source of economic insufficiency in the U.S. healthcare system. Estimates are that the cost of low health literacy to the economy is between $106 billion to $238 billion annually. This represents between 7 and 17% of all personal health care expenditures. The 2003 National Assessment of Adult Literacy also found disparities in health literacy levels among different racial, ethnic groups, and age groups. Using clear health communication can help reduce these disparities. Race, ethnicity, education level, and income are all demographic factors that cause people to be noticeably underserved by the healthcare system. Healthcare costs are a major determinant for disparities, as the well-off and educated have higher rates of health literacy generally due to more access to healthcare. By improving health literacy for all patients, the more apt they are to take care of themselves and be active and engaged in their health, which in turn helps to shrink the gaps in knowledge. Health literacy education enables patients to understand their options and be better prepared to be able to deal with their health issues, moving toward a more equitable healthcare system for all. If you're interested in learning more about health literacy levels in the U.S., please visit the link to the National Assessment of Adult Literacy. Clear health communication also affects health outcomes for all populations. In keeping with best practices, using clear and consistent communication can help mitigate the impact of low health literacy. Without effective communication, the quality of healthcare is impaired and can lead to higher costs and negative patient outcomes. If either the patient or healthcare provider lacks clear understanding of the information conveyed, the delivery of care is compromised. For example, if the patient doesn't understand the importance of a medication or side effects, they may not fill the prescription or know what to do or look for when taking the medication. If the healthcare provider thinks the patient understands but doesn't, their patient is more likely to be readmitted, make more medication errors, and have a greater reliance on emergency care, all of which lead to higher costs for everyone. The effects of poor communication can be profound. To understand what it's like to be a patient who doesn't understand, please watch the brief video from the American Medical Association. So, should you routinely screen patients for health literacy? Routinely screening patients for health literacy has not been shown to improve outcomes and is not recommended. Many of the assessment tools used for determining health literacy levels are better suited for research purposes, as they can be potentially shaming. For example, the test of functional health literacy for adults uses a fill-in-the-blank reading comprehension set of questions and numerical calculations to determine a person's health literacy skills, and the REALM, or the Rapid Estimate of Adult Literacy in Medicine, uses a series of words that the patient pronounces in front of the doctor, and that can be embarrassing for many people. Instead, multiple professional organizations recommend using universal health literacy precautions to provide understandable and accessible information to all patients, regardless of their literacy or education levels. Like with blood safety, universal precautions should be taken to address health literacy, because we can't know which patients are challenged by healthcare information and tasks at any given time. Even people with a higher degree of health literacy want information that is easy to understand and act upon. If you still want to test people, it's recommended that you use a single item screener, such as how often do you need to have someone help you when you read instructions, pamphlets, or other written material from your doctor or pharmacy. Research suggests that this type of question has a moderate ability to distinguish between patients with and without limited reading ability. but we suggest instead to ensure that you're providing understandable information to all by observing universal health literacy precautions. To learn more about implementing these precautions in your practice, see the link to the AHRQ Health Literacy Universal Precautions Toolkit. So some key points to remember from this module. Health literacy exists at both the individual and the organizational level. Using plain language increases patient understanding. Low health literacy impacts health disparities and the health status of individuals. And observe health literacy universal precautions instead of routine screening.